The doctors fighting the pandemic can sometimes seem invincible. They've been at it for a year and a half. Yet we've heard them say everybody's got a breaking point. And now more doctors are reaching out for help. There's a peer support program connecting them with someone who knows precisely what they're going through. Here's Mark Salinger.
Exactly, this phone right here.
It's not a fancy call center.
Nobody's seen anything like this.
Yet Dr. Scott Humphrey's cell phone holds the power to help.
Everybody has their limits, and what a lot of docs have gone through over this past year and a half has been insurmountable.
Insurmountable. After a year and a half of fighting a deadly virus face to face every day, doctors need help. Humphreys is on the other end of the call, ready to talk.
A lot of times the doc will say, you know what, I've just had it and I don't know what I'm supposed to do now. You know, how do I go on?
Humphreys is a psychiatrist and medical director at the Colorado Physician Health Program, a nonprofit that promotes the health of doctors and physicians' assistants. The organization started a free hotline for any Colorado doctor treating COVID-19 patients needing another doctor to talk to. They're getting more calls now than any time over the past year.
Over the past few months, we've seen a significant uptick, and that's because we thought we had the light at the end of the tunnel, but instead we're dealing with these variants, the ICUs are filling back up, and everybody's already exhausted.
A team of doctors from the Physician Health Program share the duties of picking up the calls. They're hearing from doctors concerned about treating patients, their families, and even getting sick themselves.
Psychologically, we were ill prepared for this. We didn't know that we would have to be choosing, who gets life-saving treatment and who we have to leave to be sick and potentially die.
Now Humphreys wants every doctor to know there's help, even for those used to helping others. One of the biggest challenges Dr. Humphreys says he hears about from doctors is having to wear all those masks and goggles and everything else that creates a barrier between them and the people that they're treating. Takes away some of that humanity of talking to someone face to face and letting them actually be able to see the doctor that they're talking to. And Kyle, they say that impacts them a lot.
And for anybody who's curious, that number's there on the screen. So obviously, Mark, physicians have access to all the same mental health supports that are accessible to the general public. It's that peer aspect that's so important here.
Yeah, this is a peer support program, and it connects doctors with other doctors who know the challenges that they're facing. And from there, they can connect them with other help if they need it.
All right. Mark Salinger, thank you for that.